Welcome to Medically Speaking. My guest today is Shannon Bryant, Vice President of Diversity, Equity, Inclusion, Kaleida Health. Shannon, thanks for joining us today.
Thanks for having me.
So as part of our conversation today, we want to talk about some of your DEI efforts, and in particular, some patient information, specifically sexual orientation and gender identity, and how that relates to healthcare and healthcare delivery. So if we can, let's start out by the definition or why that, sexual orientation, gender identity, often called SOGI in the hospital world, why that's important, really what it is and why that's important.
So sexual orientation and gender identity are really questions that we want to ask our patients around their pronouns, their sexual orientation, their gender identity, as well as their sex assigned at birth. Those things are important to us from a care perspective, and also we know it's important to our patients from a respect perspective also.
So this is in terms of healthcare delivery, hospital operations. This is a relatively new initiative in terms of hospitals taking that extra step, recognizing that diverse population that we serve to go and make sure that we work through that gender identity, correct?
Correct. This is something that we have been engaged with doing on our electronic side for some time. We're happy to see that it is coming to fruition. And certainly it's going to matter to our patients that come through every day.
So talk about that today. So the patients come through and they go through that process compared to where we were, say, 3-4 years ago. Is that more of a societal change? Is it more healthcare coming into realization from a DEI perspective? What's the change here?
So really the change is that we want to be able to, from the moment someone walks in the door, provide them with a signature best-in-class experience. And so part of that is knowing how to refer to people. I think health systems have always tried to do a good job at that, but our technology hasn't always helped us with it. So a lot of the work that we're doing is making it easier for our clinicians, our nurses, our front desk staff to be able to read someone's pronoun, to be able to understand what they're there for that day and respect that person throughout their entire stay with us. So really our technology is catching up to speed with practices around care that, we have always carried.
So we talk about data collection, data information in the hospital world. Obviously, privacy is a major initiative. So, people may be skeptical when they hear those terms. Why is data collection so important, and what are we doing with that information?
Yeah, that's a great question. I think, for us, it's important because, again, the things we've been talking about as far as wanting to respect people, but we also want to be able to see where we have healthcare disparities. So traditionally, this population of people who identify as LGBTQ+, they do not have great health outcomes. So part of us collecting this data will allow us to see where those gaps in care really are and do more targeted plans around supporting that community. So whether it be from an information perspective or making referrals or diagnostic testing, this information will help us to close healthcare gaps.
So those healthcare disparities for that population, the LGBTQ community, is that from a lack of access? Is it them not pursuing healthcare in a timely fashion? Is it a combination of it? Do we have any sense of what attributes that disparity?
Yeah, a lot of it is actually attributed to their interactions with the healthcare system. So not always feeling comfortable or safe coming into the environment because they may have had a negative experience in the past. And again, I think a lot of those negative experiences really were at the hands of, we didn't have the technology to do a better job always to respect people or call them by their correct pronouns. Some of those things just did not exist. So as more of that technology helps us and we're able to better do that, we want to make sure that people have a great experience when they're coming here so that they want to come back. And we also know that, we want to make sure the relationship between the providers as well as the patients are very strong. So if there are follow-up things, people are able to actually take heed to those things and feel comfortable coming to us with their issues.
I know we often say healthcare is a right, for the people that we serve, for this community. These efforts that you are working through the DEI efforts at Kaleida Health, I mean, this is part of that belief that, we serve everyone in the community. What's your philosophy in terms of how we approach patient care from a DEI perspective?
Yeah, well, I think you hit it on the head that it is a right. And we want to make sure that people have access to us and to healthcare, and that they feel comfortable utilizing the access from wherever they are in their communities.
And so, as we wrap up, the whole SOGI notion, if you were a potential consumer of healthcare or if you're a patient of ours, what can you expect as you move forward from a patient experience perspective when you come into one of our facilities or see one of our providers?
Yeah, so you'll have an opportunity. What you can expect is to have the opportunity to self-identify your pronouns, your sex assigned at birth, your gender identity, and have those things respected throughout the process. So that's really not changing too much as far as patients being able to give us that information. What will change is that we will be able to honor that throughout the stay with our patients.
And that SOGI data collection, that aligns with Kaleida Health's mission and vision. Can you talk a little bit about that?
Absolutely. So our mission is to advance the health of our community. We know that in order to do that, we have to know our community and know what their needs are. So this is directly mission critical for us. It's in line with all of our goals around diversity, equity, and inclusion. And it's really going to support our patient experience as far as making sure that all the populations that come through really have a best-in-class signature experience.
Oh, that's great. And an important initiative, obviously, not just with the DEI, but as you kind of break down through some of those different communities that we serve, the SOGI data collection as well. So, Shannon, thanks for joining us today. Appreciate all that you do for not only the organization, but for our community.
Thanks. Thanks for having me.